The Dr. Fazil Show is brought to you by Health Tips Media. The Dr. Fazil Show is intended for health educational purposes only, and complies with all HIPAA regulations. Enjoy the show.
Hello folks, I'm Dr. Fazil. You're watching September 2023 of Dr. Fazil TV show. The topic of discussion today is enlarged prostate or elevated PSA or prostatic specific antigen. So mostly we do for after a certain age, after age 50, we do PSA level once a year to make sure that if the level is good, the normal level is up to 4, which is the upper limit. Now we have to be careful when we talk about the levels, because if you're taking certain kind of medications, for example, finasteride, you have to multiply by 2. So for example, if your level is 4, if you're taking finasteride, the level would be actually 8. So a lot of doctors overlook that situation, as well as patients don't understand that. So you have to adjust the levels according to your medication. So we can easily miss high elevated PSA, which could be early indicator of prostate cancer. So folks, we do prostate exams, we do prostate checks and stuff. Enlarged prostate can cause various conditions. For example, it causes only that, it causes difficulty in passing urine, frequency of urine, or difficulty to pass finish urination, or dribbling of the urine after the person is done passing urine. But it can also cause upstream effect. For example, it can cause kidney failure. And I have seen multiple patients having kidney failure. Mechanical obstruction. Sometimes it can cause so much pressure on the bladder that bladder just distend, and even if you fix the prostate by surgery, because of prolonged distension of the bladder, here is the hologram you can see. This is a large prostate. The bladder has been distended and stretched and having a diverticula, like a outpouching of the urinary bladder. And it can cause permanent irreversible damage to the bladder. So even if you fix the prostate by surgery, by a TURP, which is like a router we call it, or a new technology is UroLift, and this is how the UroLift has been done. And you can see there's a stitch on each side of the prostate. They open up the prostate by a stitch. Outpatient procedure is very common. Done nowadays is a new technology. Or router or a TURP, transurethral prostate resection. And you can see where the urologist go in there. The urologist is the surgeon of kidneys, ureters, and the urinary bladder and prostate. Just remember that. Nephrologist is the medical side, and urologist is the surgical side. I'm a nephrologist, by the way. So I'm on the medical side of the kidneys, bladder, and prostate. So now, folks, so if you have a enlarged prostate for too long, it might not cause any symptom except the basic common symptoms, as I just said earlier in my speech today. So, but over a period of time, silently it can cause distension of the bladder. And if down the road, if you do the surgery, the urinary bladder is gone and it will not work, and you will have a urinary incontinence or retention. So get it diagnosed early by ultrasound of the bladder, by blood tests. If you have symptoms, do not hesitate to talk to your provider. It should be evaluated rather quickly and get it fixed, medication-wise or by surgery, or both, depending on the situation. Other thing is that enlarged prostate can be benign or it can be cancer. So if your PSA is high, that could be high due to infection of the prostate, or just enlarged prostate, which is benign, or most commonly a prostate cancer. So if you have elevated prostate specific antigen, PSA, then do ask your doctor what your PSA is. Then get yourself seen by a urologist. They might most likely will do a prostate biopsy. And if there's a prostate cancer, then it should be treated rather early. I mean, in the past they say, oh, you will not die of prostate cancer, you will die of something else. Those were the days when you used to live short. Now we have a long lifespan, so yes, you will die of something else and not the prostate cancer. Well, as a matter of fact, I'm saying oppositely. You will die of prostate cancer than there's something else, because people are living longer. So when the lifespan was small, yes, that was not a big deal back then. But if you have prostate cancer now, folks, get it fixed. Believe me on that. It's worth it.
The Dr. Fazil Show is now available to view at home on Roku devices and YouTube. Catch up on your favorite episodes right on your phone, available on YouTube and the BioFamily Clinic app. The Dr. Fazil Show is available in many doctor offices across Yuma, Arizona. Pick up your free copy of Health Tips magazine, available throughout Yuma, Arizona, or read our digital version at healthtipsmagazine.com.
The other thing is kidney failure. So if you have too much pressure on the kidneys, you can see in this hologram, the urine is being built up in the bladder, then it's distending the ureters. The ureters are the tube which connect the bladder to the kidneys, and kidneys are distended. You can see this is, we call it hydronephrosis on both sides, right and left. There are two kidneys. And over a period of time, the kidneys will, because of high pressure, will lose its filtration capacity and can cause chronic kidney disease. In the worst case scenario, it can become totally dysfunctional, and you will end up on dialysis or kidney replacement treatment, or like hemodialysis or peritoneal dialysis. You can see behind on my back, you can see that picture, how the hemodialysis is done and how the peritoneal dialysis is done. And in other pictures, now you can see how the hydronephrosis look like. And so it's really important. So small thing can get big thing. Prevention is better than cure. Get it fixed rather early, so we can prevent all that complication. There's no shy in getting yourself talking to the doctor about this issue. There's no glory of having a large prostate or prostate cancer and then dying of that, folks. Take care of yourself. That's common issues. Easy to diagnose, easy to fix, but the key thing is early treatment, early diagnosis, early treatment, and prevention. Or you will end up with blown up urinary bladder. Then you will have to self-cath. That means you have to put catheter every day, and that is a disaster, because now you have to either put a permanent urinary bladder back, you can see on the back, or you have to do a straight cath, like you catheterize yourself 3 times a day, and that can introduce infection. It totally disrupts your daily functional life. And then the worst case scenario, in addition to that, you can have a kidney failure. Now you have incontinence, and then you have kidney failure, and you're also on dialysis. And so starting from very small thing and become a whole lot of big thing. So folks, do take care of that. Don't underestimate the small problems. When you see a smoke, you find the fire, right? So if you see that problem, do talk to your doctor. It's worth it. On that note, folks, I will call it a day, or end of the Dr. Fazil show for prostate disorders and related conditions. I will be back next time with more useful information. Till that time, have a wonderful rest of the month, and God bless you and God bless America. Thank you so much. Dr. Fazil here.